Black lung is back. Yes, black lung is back. The New York Times reports coal miners are contracting the disease at younger ages and at rates not seen since the 1970s. Joining us now is Harvard-trained lung specialist and member of the board of directors for the American Lung Association, Dr. Vin Gupta. He's also an MSNBC contributor, medical contributor. Dr. Gupta, why are coal miners getting black lung again?
Well, Katie, unfortunately, what we're seeing is that, especially in coal mining country, places like Appalachia, it's not just dust from coal that these miners are being exposed to at younger ages, but it's other chemicals and things that we see organically, like silica, that's also getting into the dust, and it can be very dangerous and really lead to toxic air being ingested into the lungs. That's the concern here. And so we're seeing rates of black lung that we haven't seen over the last 30, 40 years. And in part, it's going to get worse because rules to monitor how much of this toxic air is being exposed to these miners are being curtailed or being paused, just most recently by the Trump administration. So it's going to get worse before it gets better.
Is there something that can happen in order to combat this? I mean, rates not seen since the 1970s. What did we do in the intervening time to get rid of it? And what can we do to stop it again?
We had surveillance systems in place, command and control structures in place, so that if we were seeing levels of, say, silica or toxic dust that was too high, we would remove miners from those areas, or we would institute strict regimens on ventilation, proper masking to make sure that exposure was mitigated. Those are now going away. They're being weakened. There was a rule that was that was suggested to be put in place in April, Katie, to make sure that silica exposure was within certain bounds of what we would consider to be less risky for a miner, and that was paused by the Trump administration until at least August. So who knows if it ever gets implemented? But the problem here is without that oversight from the National Institutes of Occupational Safety and Health and from other entities like the EPA, which are getting defunded, key people leading these agencies and surveillance programs are being fired. Without that expertise and that surveillance program, we're not going to be able to protect our miners. And that are doing this difficult work. And so that's the concern here. The people and the processes that we need to mitigate exposure to these toxic chemicals in our air are going away.
There's also cuts to Medicaid. Are the cuts to Medicaid going to affect treatment and hospital capacity or the ability to treat this?
Of course, yeah, and especially, these are places from an economic standpoint. Coal mining communities tend to rely disproportionately on Medicaid. So at one point, we're increasing the risk in the environment to the lungs of these individuals, and on the back end, we're taking away their health care. That's a 1-2 punch. I'll also say the EPA just last week, Katie, in a very similar, very not aligned to the tenets of Make America Healthy Again proposal, has now suggested that we're going to roll back Obama and Biden era regulations on carbon pollution from smokestacks. And so we're going to see that happening from a carbon pollution standpoint. Key initiatives that were driven forward just in the last year start to get rolled back. So all of us are going to be exposed to more toxic air. And then, too, for this very vulnerable community, there's no oversight, there's no expertise, and it's going to get worse. Black lung.
And tell me again what the symptoms are of black lung.
Yeah, so for loved ones, anybody that's watching that might have a loved one that's in this profession, the things that you want to look out for are shortness of breath, a chronic dry cough, decreased stability, Katie, over time to even just do basic activities on level ground, holding your groceries, walking on a level surface, maybe just doing some light activity, again, on a level surface. If you're noticing that you can't do those basic activities of daily living without increased shortness of breath, that is concerning. In addition to shortness of breath, at rest, dry cough. And that's what should prompt you to go and get seen by your medical provider, because they can do tests like chest x-rays, pulmonary function tests to really see, is there something happening here? Unfortunately, there isn't a treatment. And so once this starts to set in, it's really about reducing exposure to this toxic air. But the sooner we can detect that, if something's wrong from a symptom standpoint, at least we can mitigate further damage. And really, that's the goal.
You're a pulmonologist, so I want to ask again more broadly about the Clean Air Act and the more polluted air that we could be experiencing. Who's most at risk for that? If I'm, who am I looking out for if there is polluted air in my neighborhood?
So Clean Air Act basically being progressively torn apart, given what's happening with the EPA. Well, who we're really worried about are children under 2 years of age. That's where whose lungs are developing at the fastest clip. A toxic exposure or exposure to toxic air is detrimental to that group, predisposes to things like asthma, chronic infections. So that's who we're really worried about. Pregnant women. We noticed that if pregnant women are exposed to acute wildfire smoke for just a few days, Katie, it can impact their immune system, their baby's developing immune system. It can cause premature birth, intrauterine growth retardation, all sorts of impacts just from a few days of wildfire smoke, much less chronic polluted air from defunding of the Clean Air Act and the EPA, and those over 65 years of age or with an underlying cardiopulmonary condition. So if you have heart disease, lung disease, or you're over 65, that's who we're worried about. And so the things to make sure that we do, especially, there's a heat dome over much of the country this weekend. I'm worried about wildfire smoke. I'm worried about the impacts of these cuts to the EPA. If you have any of these, if you have an underlying condition, make sure you have your refills for your inhalers lined up and ready. Make sure you've seen your medical provider to make sure you're as optimized as possible, and try to stay indoors. If you have AC, run your AC with the damper closed so that you're minimizing outside air coming in.